There was a study by the Kaiser Health News that showed that Black Americans had a lower rate of receiving Paxlovid treatments. Could you talk a little bit about that and what you're seeing on the ground at Watts?
So it's not here because we make sure we treat those that test positive that have an underlying risk factor. You speak to a broader issue, and in 60 seconds, studies have shown that African Americans get less intervention in terms of basic treatment, lower rates of getting stents put in when they have narrowing of the coronary arteries. African American children with femur fractures were shown to be less likely to be given pain medications. Same number of children have cystic fibrosis versus sickle cell disease, but there's 10 times more monies going toward cystic fibrosis. Cystic fibrosis tends to come with white children, generally Northern Europe, Mediterranean. So there are studies that show that. So that unfortunately gets to the ugly underbelly of the fact that racism does directly affect institutional racism, directly affects outcomes in healthcare. That's a whole other issue, but you're right, and that is why.